when you do have that cheat meal, you almost feel bad about having that cheat meal, and it makes you feel a certain type of way where you kind of want to avoid it. The reason why I like the 80-20 and 90-10 rule is because a lot of times I might be in a situation where it may be perceived as rude to refuse to eat something, especially with my cultural background. I'm originally Lebanese, and if you tell someone in Lebanon that you don't want to eat,
Habibi, you're going to have some problems.
my 80-20 90-10 rule. What the heck does that even mean? Hello everyone, Assalamu alaikum wa rahmatullah. My name is Dr. Maida. I'm an interventional pain specialist. I specialize in treating spine pain and peripheral joint pain. And today I'm going to be discussing my 80-20 and 90-10 rule. First off, this isn't medical advice, and always do your own research despite what you hear on the internet, and consult your own health provider as well. Now let's get to the video. A lot of us see tons of health content online. It can be pretty confusing, especially with nutrition and diet planning. One thing I do is I follow 80-20 and 90-10 rule, and pretty much what that means is 80 to 90% of the time I'm eating clean. I'm eating the non-negotiable, almost similar things every single day. Now you probably ask, wow, that sounds pretty boring. It's actually not boring. It makes my life very simple, and I can focus on more complex tasks and allocate more time to those tasks instead of thinking about what to eat every day. The other thing is they're going to provide me with the energy, the focus, and the drive to get all my tasks done without feeling lethargic and without getting that afternoon crash. In short, 80 to 90% of the times I won't waver. I'm eating the same things every single day. Of course, if I'm tired of something, I'm gonna switch it up, but it's gonna be switched up with something that is just as nutrient dense, that is just as nutritious. This may not work for everyone. Some people need to be on specific diets that eliminate certain foods. Other people may benefit more from a ketogenic diet. Everyone is different. And as some of my patients know, some foods will trigger specific symptoms for them. There is no one size fits all. The other thing I like about this, you get to a point where you're constantly eating clean, where when you do have that cheat meal, you almost feel bad about having that cheat meal, and it makes you feel a certain type of way where you kind of want to avoid it. The reason why I like the 80-20 and 90-10 rule is because a lot of times I might be in a situation where it may be perceived as rude to refuse to eat something, especially with my cultural background. I'm originally Lebanese, and if you tell someone in Lebanon that you don't want to eat, habibi, you're going to have some problems. So with this type of diet, I have the metabolic flexibility to be able to eat what I normally eat all the time and switch it up when it's necessary. And this works very well when I'm traveling. Even if you're traveling, you can still stick to this 80-20 rule. Yes, you might have to switch out some foods, but the basics and the principles still follow you. And it also gives you the flexibility to try new things. What you gotta understand is there is no quick fix. This has to be a lifestyle change. And you gotta also understand that these habits will carry over and help you out in the long run. And it'll help you stay away from doctors, keep more money in your pocket, and decrease your overall medication list and the amount of times you visit the hospital. Thanks for watching. See you guys in the next one.